as well.
Jen Psaki there, of course. Let's speak now to Dr. Ken Duckworth, who's Chief Medical Officer at the National Alliance on Mental Illness. Dr. Duckworth, very good to talk to you. What do you take away from this interview?
First of all, my name's Duckworth, but I'm an American psychiatrist. I first want to say I might be an Anglophile, but I don't have any insight into the royal family per se. What I was impressed with was that people experience barriers to getting help in many different ways. Here in the States, people have difficulty finding help because of insurance problems, which you may not have with the National Health Service. They may have problems because in their family system, they're not encouraged to seek help. So I would say there are a surprising number of barriers to people accessing help and support for mental health problems. I would say during the COVID-19 pandemic, mental health has become more common as a problem in the States. About 2 in 5 people report clinically significant symptoms. And I think of mental health as now a we problem instead of a they problem. So I'm hopeful that people will learn from Meghan's experience and get help if they feel suicidal or are having mental health concerns.
And do you think it sends a particular message that someone with so many apparent advantages can be so devastatingly unhappy and be open about it?
Yeah, I think the human condition offers challenges to people, whether you are, living in poverty or in tremendous privilege. I've interviewed people from many different kinds of walks of life, and the human problems around mental health, thoughts of self-harm, concerns about shame, not seeking help, are somewhat universal. Clearly, having advantages and privileges and resources does make things easier if you decide to get help. But that first step, the feeling that this is not okay or I can't do this, is a human problem, I think.
Now, Harry used that word shame, didn't he? And it seems, if you accept what Meghan said, that when she went for help, she was offered none, in fact, told there was none.
I think a lot of people in the States would say that we're turning a corner here, and I can't speak for England, of course, where it's more acceptable in family systems to get help. More and more people are coming forward, particularly celebrities, but ordinary people as well. You're seeing it in workplaces. I think the pandemic has had such a mental health impact on so many people. I think it's more ubiquitous. Shame is a challenge. People need to remember that there is no health without mental health, and mental health challenges are part of the human condition. And I think if you can set the shame and put it into a perspective, this is an ordinary human process, get help for it. It's quite treatable. The outcomes are very similar to other medical problems like diabetes or heart disease.
And yet, surely telling people all about this in an interview which has a massive profile, is watched by millions and millions of people, brings its own pressure, its own burden, doesn't it? She is now surrounded by people who know, if you know what I mean.
Yeah, I think I interpret that piece, as a lens of service. There are many people who are watching that interview who have felt suicidal thoughts or have been in a mental health crisis. When a celebrity or famous person, privileged person says, I'm part of this club of people who have mental health challenges, I think it gives some people an opportunity to say, me too, I am in this as well. And if she can have this, I can have this. So I would interpret this through the lens of a service to people. When people share their vulnerabilities, I admit it's more American than British, but as a rule, I think it creates space for people to give permission to ourselves and to each other for these ordinary human conditions.
Dr. Duckworth, thank you very much for talking to us.
Thank you. Take care.